Hello guys, welcome to Lifestyle Thursday with me, Sylvia Wanja. I know this is a new show and most of you are wondering what is happening here. But on Thursdays, we will be bringing you lifestyle matters and we'll be tackling them right here in the mid-morning show. And this is Lifestyle Thursdays. And kama kawaida, I am not alone, but I'll be hosting this beautiful show with Faith Mwema today. Faith.
Good morning.
Good morning.
A very good morning to you.
How are you?
I'm doing well. How are you? Looking
I'm also good. You're also looking good, you know.
you.
Lifestyle, no, you're not letting us down.
Lifestyle.
I see you.
But you know, there are people who, when it comes to lifestyle, they just think it's just about food and just food. You know, how you're eating and all that. But it includes a lot of things. Yes. My name is Faith Mwema.
Yes.
Welcome.
And remember, here in Lifestyle, we'll be tackling so many things, right? Tukiongelea how people dress. We'll be talking about fitness. We'll be talking about nutrition. And we will not let you down because this particular month in October, right? Tunaongeleanga mambo na inakwanga breast cancer awareness month.
Yes.
And most of the people have had so many questions about what breast cancer is and what it entails. Some people have some myths and misconceptions. Ati, oh, if I'm young, I cannot get it. It's only inapata tu wale watu wazee.
Yes.
So all these myths and misconceptions, tunaanza in style hapa ndani ya the Lifestyle Thursday to tell you more about what breast cancer is. And there's some very interesting facts, Faith.
Yes. You know, I was doing my research and I found out that breast cancer, it is one of the leading cancers that are killing people in Kenya. And doctors say that once it's detected early, you can have treatment and you cannot die if it's detected early. But majorly, a lot of people say, you know, it's cancer, a lot of myths, cancer ni ugonjwa wa tupatajiri. When you eat burger, sisi watu wa Managu, you know.
We are strong.
We're strong.
Our genes are very strong.
Our immunes are strong. But you know, it's not a disease for the rich or for the poor. It's anybody.
Anybody is prone to get it.
Anybody.
However, we need to scrap off those myths and misconceptions from our minds.
As well as even men. There is also breast cancer for men.
I also heard that. And I was shocked. I'm like, Ati?
Yeah. And you know, for men, we always, for men, they're like, it's just for ladies. It's just for women.
If I kunisumbua.
Ni hata nikisikia niko na lamp, hii ni kama nikunaona, ni vile nimehit the gym.
Yeah.
So I'm getting bigger, you know. But it's killing. It's killing.
True. And we really need to be woke, and that's why we have Dr. Martin Ombati from Nairobi Women's Hospital, Nakuru. Sorry, Dr. Martin Abuto from a medical officer from the Nairobi Women's Hospital, Nakuru unit. And amekuwa akipractice since January 2022. And his major interest iko kwa general surgery. Now he has been doing research on the same. And now he's here to give us more insight about what breast cancer is. It's very important during this time to jue. You might be having a loved one who is suffering from the same. You might be having a neighbor, someone close to you, a friend who might be suffering from the same. So it's important for you to know. And if you have any questions, the doctor will be here to give us more details. So yes, don't shy away. Send in those questions. We need to know what you think about that. Karibu sana daktari.
Thank you so much.
Yes. Introduce yourself to the viewers and tell them who you are and what it is that you do.
Okay, first of all, thank you so much for the invite to your studios today. Because as you have said, October is always a breast cancer awareness month. And it's always good to educate the population, the rest of the public.
Yeah.
Because currently our main focus is to prevent or undiagnose the breast cancer so that we can easily manage or completely treat it as well. So my name is Dr. Martin Yamo Abuto. I'm a medical officer, resident medical officer at Nairobi Women's Hospital, Nakuru. And I've been practicing for the past 2 years. As you said, my interest in general surgery and breast cancer is also part of it. So we normally strive, we do so much research, we do so much reading on the breast cancer, so that at least we can educate someone. We can pass the information to someone so that they can know. They can know when there's a lump in the breast, there's something abnormal in the breast for both men and women. And this can be really helpful in early diagnosis. So thank you so much.
Yes, that is very, very important. And thank you for that insight, Daktari. And now tell us, let's start from the top. What is breast cancer?
So, as you said, there are so many myths surrounding the breast cancer. Because breast cancer, in a layman's language, this is a malignancy in the breast tissue. So this abnormal growth of cells in the breast tissue.
Yeah.
So anyone with the breast tissue can actually get breast cancer. That's why it can all men and women can get breast cancer because we all have breast tissue. So breast cancer in Kenya, the latest studies or research done is among the worst cancer where you get there are very many mortalities surrounding the breast cancer. And being like the month of October, I know there are so many listeners getting us around. And the problem here we got is the late diagnosis. Most patients come to the hospital when the cancer is advanced. And when the cancer is advanced, they normally very poor prognosis. They very poor outcomes with advanced tumors. So breast cancer is cancer of the breast. It can affect any tissue of the breast. Then from there, it can spread locally or to the rest of the body. Yes.
So from the breast, it can proceed to other organs.
It can proceed to other organs.
And also affect them.
Affect them.
So you should get treatment immediately.
Immediately. So what normally say is that for women, they want this screening done. Screening done can be the best screening to be done is personal level. Just as personal, or you can do it monthly or daily. Just check your breast. If there's any lump, there's any change in skin, there's any ulceration of the breast, there's any pain, there's any nipple discharge. So you don't wait for the doctor to check that. You as the patient, you as a person, you can be doing that on a daily basis. Because if there's something abnormal, you'll easily note it.
Yes.
True?
Yeah.
You'll easily note it. Because the time you're taking a shower, just walking around, you really feel some pain in the breast, some abnormal mass in the breast, or some abnormal ulceration.
Yeah.
Never ignore that. Any day you feel something abnormal in the breast, better go to any hospital nearby, be it public or private, and get checked up.
At what age now, or?
So if we consider the age, so anyone at any age can get the breast cancer. Like in most studies have shown that more so in women, advanced age, above 50 years, 60 years, they are more at risk of getting breast cancer. So for age, is advanced age. In fact, for both men and women.
Yes.
Yeah, they are at risk as the age goes high. Above 50 years, 60 years, they are at risk of getting breast cancer. Luckily nowadays, you find that there are so many lifestyle changes. There are so many lifestyle modifications which the general public are using, and these lifestyle changes, you find that normally they affect that.
Right.
So at any age, you can get the breast cancer because there are so many hormones we are currently using. There are so many bad food we are taking. We are taking so much cigarette. We are taking so much alcohol, and these normally increases the chances of getting breast cancer. You understand?
Yeah.
Yes.
And what are we looking at in terms of numbers? Because majorly Kenyans, when we hear about breast cancer and more majorly cancers, we always think it's far-fetched, it's from far. In Kenya, how are we?
So in Kenya, you find that as we speak today, breast cancer is the topmost cause of cancer-related death, followed by cervical cancer. So breast cancer in Kenya is a very great deal. If you walk to the wards in the public hospitals, you walk to any ward in this facilities in Nakuru, you will likely come, maybe find a patient which is being currently managed for breast cancer. Yes. Yeah.
So it's really.
It's really, there are so many patients with breast cancer. Then to add on that, you find that they normally these benign breast lesions. Benign breast lesions, I can tell you there are so many. The exact figure, I'll share with you later. Benign breast lesions are so many. In fact, almost, let's say 2 in 10, 2 in 10 women, at one point, they will tell you they had a breast mass, which they visit a facility, then it got excised, or they're still having it. Either because of the fear to visit, or the fear to be diagnosed with breast cancer, or just the fear of unknown, because they fear being diagnosed with any tumor, so we prefer to stay with it. There are so many of them. Yes.
So people need to be more bold.
Yeah, people need to be more bold.
Come out of their shells.
They should, in case they detect something abnormal in the breast, the best things they should be doing maybe just visit that facility.
Yes.
Because it can be life-saving. Yes, it can be life-saving. Yes.
Before we get to the treatment, what are some of the, you mentioned about hormones and lifestyle issues that we predispose ourselves to, and we get cancer. What else?
So to just go systematically, so there are so many risk factors for breast cancer. And the top of the most is genetics. So normally in genetics, there are various mutations which normally occur to our genes, which may predispose us to breast cancer. So in genetics, this is something which we normally have no control over. So in case you have a family history, maybe your mom, your grandmother, your sister had breast cancer, the best thing you'll be told is that to go for frequent visits, because already you have a family history. So there could be genetic mutations which can be inherited from mother, grandmother, or family, or any distant, even distant relatives, because you never know. So once you have a family history of breast cancer, that's already a risk. Whether you're a man or a woman, you should be going for routine checkups of the breast, or you should be doing routine self-breast examination. This is something you just do alone in the house. So the number 2 risk factor is hormones. So normally for ladies, there are so many hormones which normally either you get it through contraceptives and either all through hormonal replacement treatments. And also there are various ways where we get predisposed to more estrogen, because estrogen is the hormone here. You understand?
Yeah.
Yes.
So contraceptives alone, I wouldn't say that they act, maybe, I wouldn't say contraceptives alone won't cause you breast cancer. Like in contraceptives, together with the other risk, increases the threshold of what getting breast cancer. Because these contraceptives, most of them are hormonal.
Yeah.
You understand?
Yes.
So being that they are hormonal, they increased the risk of getting breast cancer. So another risk is cigarette smoking. So cigarette smoking has been detected in has been said to be predisposed to most cancers in the body, because cigarette smoking normally lead to various mutations in the cells of the body. The same thing to alcohol. So cigarette smoking and alcohol together, they normally lead to obesity. So obesity is another risk factor. So people should be check on their weight, because if you're obese, where the BMI is above the normal, normally you find that in most of the time the body could be having more estrogen as per
The normal.
the normal. So the excess of estrogen is something which predisposes to excessive breast cell growth or breast tissue growth. You understand? Then another risk factor, there are normally some syndromes. So these syndromes normally people are born with, such as Klinefelter syndrome. These are syndromes mostly affect men, where they normally have an extra X chromosome. So no X chromosomes are normally found in ladies. So if you have extra X chromosome, they tend to have feminine features. And the feminine features can be reflected in the breast tissue. So they have an excessive breast tissue, and from that, they are more predisposed to getting breast cancer. You get it?
Yes.
Yes. And also, there are other risks, let's say, when you have cancer in this breast, and maybe you had surgery done because of cancer on that breast, so there's increased risk of getting cancer in the breast.
Okay.
Yeah. So normally, this normally affect maybe older women. After undergoing maybe mastectomy, that's surgery to remove the breast because of an early breast cancer detected in early stages. There's an increased threshold, or there is double fold risk of getting cancer in the breast. And that's something normally people don't know. People normally say, if you had breast cancer in this breast, so that's you're done with it. You're not done with it.
Yeah. You need to keep going for
You have to keep going for the
treatment. Okay, guys, as you can see right here, we are joined by Dr. Abuto, who is giving us more insight on breast cancer. And I hope that you're picking these pointers and you're really paying keen attention. Now, we are going to take a quick break, but remember to send us your feedback. Ask any questions that you have. Najua maswali ni mingi zenye uko nazo. If it's someone in your home, if it's your mother, kama ni sister yako, kama ni a friend, ama kama ni wewe unataka kujua how do I screen myself? Yeah, do I have to go to the hospital so that I can get screening? Ama I can just do it by myself. Now we'll be coming back with the doctor, na atakuwa kitupea insight ndo tujue niaje. Daktari, can we get that demonstration? How can you do it yourself?
No, I'll demonstrate that before we finish, so that at least everyone can know how to do it just by themselves.
There's a way you can do it by
Even
yourself.
if you have a partner, the best.
And does this apply even to the men?
Yeah, it applies to the men.
Yes.
In fact, for men, not the challenge with breast cancer we have is that the symptoms are all very silent. Because if they have a breast mass, it is not painful. It's a painless breast mass. So people with painless breast mass normally assume it. So the possibility of ignoring it is very high.
Yeah.
Compared to something which is painful, which will lead to the hospital. This is something very painless.
So you
Haiko
just
affect
ignore
kabisa, you just ignore it. Hii niko nayo. Hii niliona last year, iko, but now the challenge, it keeps growing.
Wow. It keeps increasing in size.
So the time maybe you have some skin ulceration, it's not the time you want to now go to the hospital for checkup.
Now stage
That's the only problem. That's the
Taking
only
time.
problem.
Buying yourself time.
Na ukimuuliza when did you know this thing, anakuambia this thing out in 2018. Na mbona ukuja hospitali hainihusu? Hainisumbui.
Sisikii
Unaona,
uchungu.
sisikii uchungu, kazi yangu ni kawaida. So that's the challenge actually we have with breast cancer.
Wow.
It's a silent killer.
Okay, so guys, remember to send us your feedback 0721105105 WhatsApp, I'm a normal text, and 23814 SMS code, which is absolutely free, and MBCI TV, Facebook, we are also live. So send us your feedback there. We will be coming right back. All questions that you have concerning breast cancer, this is where you're going to get your answers. So make sure you send them to us. We'll be coming right back.
MBCI Television, transforming lives.
Tune in this Thursday from 7:30 to 8 in the PM katika kipindi cha Mulo Wetu. We will be showing you on how you can prepare your creamed tomato soup served with bread croutons.
Cheese yako umwagilie juu.
Okay, ya ile mkate yetu sasa. So hii ya kwenda kwa oven haikatakatwi.
Sasa wakati itaiva ndio tutaweza kuikatakata sasa.
Wow, interesting. Yes.
Wakati sasa imeiva ndio tutaweza kuikatakata. So unaacha supu yetu ichemke.
Juu umeongeza ile maji sasa.
Nimeongeza ile maji.
Okay.
Na unajua sasa tunamalizia, nilikwambia tunamalizia na nini? Na butter.
Oh, butter, yes. So tunaiongeza
hapa. Tunaweka hapa.
So after pia tumeiblend bado tunairudisha jikoni.
Tunairudisha jikoni. Hivi sasa uongeze butter yako.
Okay.
Na butter.
Tune in this Thursday from 7:30 to 8 in the PM with me, Perpetual Nyambura.
Experience a journey of spiritual elevation and immerse yourself in the most uplifting worship moments. Watch the best of worship culmination every Saturday from 3 p.m. to 5:30 p.m. It's an awe-inspiring event featuring anointed worshippers and going beyond the studio to connect with young souls eager to embrace the divine presence in educational institutions. Get ready to elevate your spirit and embrace the true essence of worship with Maria Omondi and her incredible team of worshippers.
Hujambo na karibu katika taarifa zetu. Ni wakati wa kukujuza yanayojiri ndani na nje ya taarifa zinazotufikia kwa sasa. Taarifa ni muktasari tu, lakini katika jamii yetu tunadadisi kiundani na kukuletea kina cha jambo. Ni aje wakajikuta ndani, ni yapi ambayo waliyapitia na kutengeza vile ambavyo unaviona.
Unakata glasi.
Afya bora, tamaduni, elimu, mazingira, hata majanga. Maswala yaliyo na mguso yanayokuhusu kwa njia moja ama nyingine.
Nasema sisi tuwe kitu moja.
Au kukula gani?
Ilikuwa positive.
Uze anything. Wakisikia kuna shida ni vyema kukuja kufanywa check up.
Yote haya ni kwenye makala Jamii Yetu kila Ijumaa saa 12:30 jioni hadi saa 1 usiku, ukiletewa nami Enaeli Mlinga.
Hi there, my name is George Washuri, CEO Optiven Group, and I'm very excited to introduce Ushindi Gardens Nakuru. This property is developed by Optiven, and we are doing compacted maram roads. We plant the trees, fence the property. What's unique about this property? It's only 1.2 kilometers off the highway and 18 minutes from Nakuru City, the pink city. So please call this number 0790 300 300. Optiven, we have you covered.
MBCI Television, transforming lives.
Yes, welcome back, guys, to Lifestyle Thursdays with me, Sylvia Wanja and Faith Moema. Now, we were discussing about breast cancer, and as we said, October is Breast Cancer Awareness Month, and we thought it important for you guys to know more about breast cancer and have all your questions answered. Now, Daktari,
yes.
Let's go back into whatever we were discussing, breast cancer. We were talking about the signs and symptoms of breast cancer. How can I tell that I need to go get checked?
Sure. So, as I said earlier, you tend to find that most of the signs and symptoms of early breast cancer, they're normally so non-specific. To an extent that you may not know there is something abnormal. But unless you are so keen with your breast, you'll find that there's some change. And in most cases, the first sign normally is there's a breast lump. There's a mass in the breast. Kuna kitu kiguza, unasikia kama imefura kwa breast. It can be both sides or just one side. It can be as well. It can just be a single mass, or they can be many. So you will note that. Very easy to note. That kuna abnormal mass in the breast. So this mass, most of the time, is very, very painless. So that's the first sign. There's a painless mass in the breast. So most of the time, the mass normally increases in size. So there's an increasing mass, the size normally grows. Poly too. Then you tend to find that there's changes in the skin. Now that's where most people tend to get scared. Because initially, there's just a silent mass in the breast. Then as time goes, there's some now changes in the skin, and maybe there's ulceration in the skin, or there's itchiness, or there's dimpling. So the dimpling one, something we call peel d'orange, change of the skin, is the most common. So just above the mass, there's some dimpling. You see the peel of an orange. So how the dimpling is, small holes. Most people note that, then they come to the facility. And the moment you know that there's the dimpling of the skin or ulceration, trust me, we are dealing with maybe stage 2, stage 3.
It is already advanced.
The cancer is advancing. So if you tell maybe the patients you meet at the facility, the first sign, in any case you note there's a mass in the breast, come to the hospital. And one thing I tell you that if we diagnose it early, it can be curative. Early diagnosis can be curative because the treatment modality you will have can help for life.
So after you've noticed the lump, we just come to
the facility. And most of the time you find that in the population, there are so many ladies or women with breast masses. And majority of them normally are benign, actually. Majority of them are benign breast lesions, something called fibroadenoma. So fibroadenoma is maybe you find there's some small mass in the breast, and when you touch it, it is playing. It keeps changing, like it's very slippery. You understand? Then there's some masses. You touch it, it's fixed. Non-tender, that means not painful. It's just fixed. So regardless of it, any mass in the breast, come to the facility. Number 2, any change of the skin color or any change of the skin of the breast, come to the facility. Then number 3, the nipple. Most of the time, there's abnormal discharge from the nipple. So it could be maybe the discharge could be blood stained or just a normal color, brownish. Come to the facility because you never know.
Yeah.
Yeah. Just come to get screened for breast cancer.
And even for men, there is...
Yeah, even something applies to men. So, in fact, for men, the breast cancer in men also like the incidence is very few cases. But most men normally even don't know that this cancer until the time the tumor is advanced, because most people don't know that the breast cancer can affect men. So the same symptoms. There's a mass in the breast. There's skin change colors in the breast, and also there's a normal nipple discharge.
Yes.
From the breast.
Right.
Yes.
And for ladies, if I may ask, during the cycle, there are different stages where the breasts are tender. And
so that's normal. So during the menstrual cycle, during early pregnancy, you tend that there's breast tenderness. That's normal.
So it cannot be confused with?
It cannot be confused. Breast tenderness is normal. Also for lactating mothers. Normally, you find breast engorgement. Lactating mothers, when the breast engorge milk, more so if you're not breastfeeding well, or when there's too much milk.
Yes.
And also, breastfeeding mothers normally confuse breast abscess with breast cancer. Because most of them normally, whenever they get breast engorgement, so this milk literally stays in the breast, it is not coming out. Then any small crack on the nipple or on the skin, now the milk get infected. Then they have a very big breast abscess. So the whole of breast, maybe there's a burst wound. There's a very big wound on the breast. Normally there's no breast cancer.
Right.
Then we come to a city, we treat you, we do the alignment, wash it out, clean it, it heals.
Okay.
Yes.
But don't say it's not cancer unless the doctor tells you.
Yeah.
So most patients normally come to the facility with there's already a wound. There's a big wound in the breast. So this is an elderly woman with a wound in the breast.
Yes.
Most of the time it's breast cancer. Yeah. And if you try to follow up on the history, they will tell you that the first time they knew this thing was a long time ago. Maybe 3, 4, 5 years ago. They were ignoring it. Number one, no one wishes to be diagnosed with cancer. That's number one.
Everyone is scared.
Number two, this thing is very painless. Haita kusumbua usiku. Kuna kidonda umepack vizuri, uko sawa. Until now you start getting a wound, which now normally there's some foul-smelling discharge from the wound. After you can't stay easily in the house. So the discomfort and the extensive, the big wound just doesn't mean we can bring to the hospital. Yeah. So people should be very keen. Yeah.
Okay, so guys, I hope you're really taking keen notes on the things that we're talking about here. Now, there are some few people in the streets when you're gonna comments about the same and questions. So let's listen to them as we wait for the feedback to load. Yes, let's get the Vox Pops.
Mambo? Now, this month tunafanya breast cancer awareness month. Now, umesikia any lady mwenye akona breast cancer ama umesikia anything about breast cancer for ladies?
Mimi nasikianga iko lakini sijasikia yoyote mwenye akonayo.
Na unajua vile mtu anaweza kujitest ndio ujue kama uko na breast cancer?
Sijaijua hata sijawahi.
Alright. Na any symptoms za breast cancer?
Kwangu.
For anyone, unajua symptom yoyote ya breast cancer?
Sijui.
Alright. So for this episode, show yenye tunafanya leo, utakuwa ukijifunza about breast cancer na vile unaweza jitest for breast cancer. Ndio tuna create awareness.
Sawa.
Na pia you share with your friends.
Sawa.
Mambo?
Poa sana.
Unaitwa nani?
Naitwa Bilha. Yes.
Alright. Sasa this month ni month ya breast cancer awareness. So tunaongelea breast cancer. Ushasikia about breast cancer?
Yeah, nimesikia. Kuna one of my friends alikuwa na hiyo shida ya breast cancer na ilimletea shida hadi akakatwa. Yeah.
Ole.
Her left breast. But sina experience vile huanga inakuja na sijui anything kuhusu breast cancer.
Okay. Yeah. Umewahi sikia vile mtu unaweza jitest mwenyewe for breast cancer even before wende ukaangaliwe hospitalini?
Yeah, kuna mahali nilipata wakitest. It was in Nairobi. Walikuwa na Red Cross whatever. na wakatuonyesha jinsi ya kujipima. Yeah.
Okay.
So niko na idea ya vile mtu huanga anajitest in case of anything, ukisikia any pain or any issue.
Thank you so much for your feedback. Tutakuwa tukionyesha watu pia about breast cancer.
Welcome.
Yeah. Okay. Mambo?
Poa sana.
This month ni month ya breast cancer awareness. So, unajua about breast cancer?
Yeah, I know about breast cancer.
Have you ever had mtu mwenye ako na breast cancer?
Yeah, I've had an experience actually from family.
Okay.
Yeah.
Mwenye amekuwa na breast cancer?
Yeah, it's 2 months ago I lost my cousin at a very young age, at 27 years old. And it was metastatic breast cancer. Yeah, so I've had an experience. I've watched her go through the chemo and going through the pains actually up to the last minute when we just lost her recently. Yeah.
And unajua vile mtu unaweza jitest for breast cancer before it gets worse?
Yeah, I know, especially the early signs. You know, having an experience of a family member, it gets you have an interest actually to go deeper and just know what's all about breast cancer. Yeah, and so I know, actually I'm informed about it. Yeah.
Thank you so much for your feedback and we're sorry for your loss. Asante.
Okay, so that is it. Tulikuwa na Rachel Kahugu akiongelesha watu, and you have heard from the people out there. There's one who is completely ignorant, kuna wengine hata hawajui ni nini, you know, there's a lot, and that is why it is important for you to get educated right here. No, daktari.
And you know, actually, the intensity, it's 2 out of 3. They have had experience. Whether it's first hand or second hand, it is experience that is at home. So this thing is really a silent killer.
Yeah, for sure.
Yeah.
So when we discuss on the diagnosis, you find that normally use triple assessment, and the most important part of that is the patient. So what you feel at home is the most important in the diagnosis. So you just walk into facility, maybe you have malaria. Walk into facility, you have malaria, you get treated for malaria, but all this time you've been having some breast pain or breast lump. Then you just be silent. So that's a mistake most people normally do. Anytime you visit a hospital, be very complete. Say everything.
Yeah.
So at Nairobi Women's Hospital here, we normally tell our patients, wherever we asking for any symptom or any sign, just try for any woman, any lady, just try to be have any breast lump, have any breast pain, any nipple discharge in the past. Let the answer be no. As compared to just ignoring it, because it can be shocked. Yeah. So on the diagnosis, we rely on the personal history, what you tell us, the breast pain, the breast lump, and everything. Then normally we do imaging. We do imaging. We can either have an ultrasound done or a mammogram, depending on the age of the patient. Then from the imaging, if we detect there's a breast mass from the ultrasound of the mammogram, we normally do an cytology and histology before we diagnose it. Because the most common type of breast cancer is a ductal carcinoma. This is something can only be diagnosed by histology. We take either some fluid or mass from the breast mass, we take it to the lab and see whatever it is. Yeah. So the pre-diagnosis modalities are always very important. So some patients, you find that we send them, maybe they are told, maybe they go for histology. One of the great challenges might be pay. Maybe they can't afford, mostly in the public setting, or they just disappear. Okay, sama, daktari anasema, sina. Then 2 years later, you meet the same patient. Normally very, very painful. So the population should know that whenever maybe you are told we need to do a histology on this, we need to do cytology on this, be keen on that. Because that can save your life. You understand?
Yeah, and from one of the ladies, I've had her mention something about metastatic. Yeah. What is that? Are there different types of?
They're not different. Metastatic, in layman language, means that the tumor, the cancer has spread to the rest of the body. It has gone to the liver. It has gone to the lungs. Now that's metastatic. Yeah.
But
it
it
has
started
spread to
from
the
the
rest of the
breast.
body. It started from the breast, then it went to the rest of the body. Yes.
I'm just
Those are
imagining.
advanced tumor.
I'm just imagining. She said she was 27 when she was dying. So I'm just imagining at 22, if she would have gotten to know it's cancer, we
probably will be telling a different story right now.
And also for most people who have had family member or a close family member with breast cancer, normally go for routine checkups. And the best thing to tell a person, whenever you're passing through a facility and you find that there's an NGO, there's some hospital doing some routine breast cancer checkup, just to visit. It only costs you 5 minutes. Just pass by, get checked up, then continue the activity. Because you never know.
Free of charge? Or?
Free of charge. Most of them are normally free. Yes.
I think what is eating through our society right now is ignorance.
Ignorance.
People are very ignorant because you can hear someone saying, I know about breast cancer, but what do you know about breast cancer? Hakuna kitu ninajua. You know, because we know it is there, but we're choosing to live as if it's not there. Like it doesn't affect me closely or I don't understand what is happening with it, so it doesn't concern me. But the thing is, you never know, it may be lurking somewhere around, waiting for the perfect time to attack. So it is very important, guys, for you to educate yourself, know about these things. You could be the one to help someone in your community, your neighbor there. Don't be ignorant about these things. It's very good to have this knowledge so that you can help someone other than yourself as well. Sawa sawa?
And Daktari, what are the barriers to treatment?
So that's a good question. So in Kenya, so there is determinants of health, and the top of the list is economic determinants of health. So most patients normally fear going to the hospital, or they don't go to facilities because they don't have the finances. Because investigating cancer and treating cancer is normally, it needs money. That's for a fact. So most patients, either they lack the finances to go to the facility. Then number two, they lack the knowledge. They don't know. They don't know. Because most people normally respond to pain. If you have pain today, possibility of going to the facility by evening is so high. Utaenda hospitali, juu uchungu hakuna mtu anapenda kuvumilia. When something is painless, watu wanakaa tu. Hakuna mtu anaenda hospitali, watu wamekaa tu nyumbani. So that's ignorance. Yes. Then number three is when maybe you go to facility and maybe the healthcare workers, maybe they assume, or maybe there's a misdiagnosis, which is normally very, very rare. You understand? So breast cancer is normally very, very specific. Misdiagnosing is very, very hard. So the major barriers in Kenya as we speak, in our regions, is ignorance and finances. Yeah.
Right.
Yes.
So now we get.
And also the fear, maybe the phobia, when there's no one who wishes to be diagnosed with cancer.
Sure.
So when they start thinking, hii inaweza kuwa cancer, wanapenda tu kaa nyumbani.
Let me just die.
And maybe the stress, or because everything surrounding cancer they know is very bad, going to die. So this knowledge, if I tell my children, watakuwa very, very helpless. So they prefer to stay with it silently instead of going to the hospital.
Yes. And what happens if you're diagnosed with cancer? What are the measures to take first?
So when diagnosed with cancer, at our facility, we normally first do counseling, because this is a big deal.
Yeah, it is.
Both to the healthcare workers and the endpoint, even us. This is something which affects us psychologically. So the first thing you do counseling, so that I can accept that I have cancer. So accepting that I have cancer will greatly affect the treatment, because I will accept the modes of treatment. I'll willingly go to the facility when required. I won't disappear, because that's the most important thing. Because you've done your diagnosis, everything, the histology has pointed towards breast cancer. Cancer of this patient, then initiate the right treatment. Because now for this early breast cancer, most of stage 1, when surgery is done, that can be very, very curative. Like in stage 3, stage 4, we can't do surgery. Just do chemotherapy and radiotherapy. What we are doing also in advanced tumor, just palliative care. Palliative care. Because the cancer is already advanced, there's nothing much you can do. Now, to prevent this, people should be informed on when to diagnose early and what to do whenever there's an abnormal breast mass in the breast. So the prevention can really work. For those with family history of breast cancer, routine checkup, very important. Every month, just visit. Every 2 months, just visit. Annually, just keep visiting. Yes.
Okay, there's Jerry from Embu has a question here. She's asking, is a pimple on the breast a reason for worry?
No, I can say, what I can say is that it could be, because number one, we don't know the size of the pimple. Then the duration, most pimple takes 1 or 2 days to disappear. So if you have a pimple in the breast taking more than maybe weeks, then you should worry. If you have a big pimple which is not disappearing, you should worry. Because as we know, pimples maybe 1 or 2 days gone. But if it's staying there forever, then you should be worried.
There's something.
Yes, yes.
Okay, Jerry, seek medical. What advice would you give to
So I can tell her maybe if the pimple has been there for quite maybe more than a week or 2 weeks, just get checked up. Maybe it's a big one, get checked up. Because there are also very many things which can cause pimples on the breast, not necessarily breast cancer. You understand? Yeah.
And on pimples, there's someone asking about pimples around the nipple.
So is she breastfeeding?
No.
Not breastfeeding. So normally, it's normally normal to have maybe this small swelling around the nipple, more so for mother with high parity. Mothers with many children. So normally, if you see the perioral area, there are these small and tender nipples around it. That could be normal. Unless they start feeling itchiness, maybe they are growing in size or pain around it. Yeah, because this small pimple around it, that's normal. Shouldn't be worried. Yeah.
Okay. There is hajasema jina lake, but anauliza, what about cracking around the nipples? Is it a cause for worry?
No, there is a cause for worry, more so when you are breastfeeding. So normally, lactating mothers tend to have cracks in the nipple. And what that will cost you, it will cause you a breast abscess. For a mother who is not lactating, get so much worried when there's a crack on the nipple. Because what will be causing it? You're no longer breastfeeding, then there's a crack on the nipple. So for lactating mothers, any crack on the nipple, seek care. Because also managing breast abscess normally is a big deal. Because a greater part of the breast has a pus and you need to go for surgery to relocate it. So a crack on the nipple, which is very painful, just seek care. Yes.
Wow, okay. And talk more on chemotherapy and radiotherapy. Is it important, or after maybe I've been diagnosed, I can decide to change my lifestyle? And it just
so
clears?
what we normally do is that on chemo and radio, so it's us to direct you on that. You can't just go, maybe you have some mass or whatever, then you go to see chemo radio. So the treatment modalities normally depend on so many things. Number one is maybe the stage of the tumor. There are so many staging systems, and in Kenya, normally use the Manchester staging system. So stage one, this is just a tumor confining the breast, a very small one. And most of the people, they tend to undergo surgery. And normally that's very, very curative. But for advanced stages, stage 3 and 4, there's chemotherapy and radiotherapy. And in Kenya, also in the world, these modalities are normally currently so advanced. There are so many good therapeutic agents. There is current use of brachytherapy in treatment of breast CA. And this has really helped the population. Yes. Yeah.
So you can just decide now.
No, you
that
can't
I've
just
been
decide.
diagnosed
That
with
is for
cancer.
medical team, the oncologist, the medical doctor, to decide that for this stage, you're going to use radiotherapy or chemotherapy. Yeah.
And how
currently,
effective are
they are very effective. Currently, there are so many new modalities. There is use of technology in treatment of advanced breast CA, and for most patients with breast cancer currently, they don't suffer as before. So the treatment, the chemotherapy agents normally at least they isn't life for them. At least they reduce the pain, they reduce the spread of the tumor, they reduce the tumor, everything shared with it. At least I can say there's a great advancement in the treatment of advanced tumor and also for the treatment of early stages. Yeah. But that's us to now inform them. So what you want from the population is early detection. So they should be keen on the signs so that they can come to the facility for early diagnosis. So we know we can't measure on treatment of advanced tumor, but we can measure on prevention and early detection because that's where the line is. Yeah. Any advanced tumor, has a very poor prognosis as compared to this early disease. So whether you use chemo or radio, as long as the tumor is advanced, the prognosis is very poor. You understand?
Yeah.
Very, very poor. You can't do surgery. Whatever you're doing, you just lengthening the life of this patient. So our main topic here should be early detection and prevention. Yes.
Yes.
Yeah.
Early detection.
And this applies to all cancers. Early detection and prevention. So most of for ladies and men. So for men we have prostate here. And for ladies we have cervical cancer, we have breast cancer, and also we have other malignancies. So it should be a norm that whenever you're passing through a place, they're doing free checkup. Even for the sugars and pressure, make it routine. Just be passing through that place. Make it routine. In Nairobi, you may have various outreach programs where you normally do this. Whenever you hear what's around, pass by.
So guys, there you have it. I hope you're really learning these things. Tumesema it's good not to be ignorant. You need to capture these things and make sure you have them on your fingertips so that you can educate the next person mwenye ako karibu na wewe. Now, Daktari, as we wind up, there's this one question I would like you to answer, as well as also talk to the viewer out there who is watching and tell them what measures they need to take, like give them a word of advice. So, hello, I'm Immaculate from Nandi. Have a question to doc. Aki nimekuwa na worry sana nikifinya breast, natoka vitu kama maziwa na sinyonyeshi na sina mtoto. Na haina uchungu. So using that camera right there.
How old is the patient?
She hasn't mentioned her age, but she doesn't have a child.
So that's what we said as we were starting the discussion, is that breast cancer can also manifest as abnormal nipple discharge. So when we press the nipple, there could be abnormal discharge. So what she can do, let her go to the nearest facility. We do the examination. If there's anything, then we do an imaging. If there's anything, and if we find something, we'll take it to the lab. So the advice I can give her, to visit the nearest facility. Don't stay at home when you have a normal discharge from the nipple. It could then from maybe if she goes to the hospital, utapata kuna kitu. Imefanya 1, 2, 3 na mambo iko sawa. Sasa narudi nyumbani. Lakini atarudi nyumbani kama ako sure ya kwamba on the breast there's nothing. Kuliko kukaa nyumbani na ko worried lakini she's doing nothing about it. You get?
Yes. Okay, so say a word to the viewer about breast cancer and what they need to look out for in about 1 minute, and maybe if someone has questions to ask, how they can get you so that you can give them more insight on breast cancer.
Okay, just to wrap it up, what I can say is that most people have not come to contact with patients with breast cancer. Majority wamesikia tu from people. The most important thing is self-breast examination. Every day when you wake up, maybe you go going to bed, whenever you note something different from your breast, take note. Don't ignore. Whenever you note something, maybe there's different ulceration, there's different swelling, there's a different mass, be very keen on that, because that could be life-saving. So the moment you ignore it, it advances. Maybe it turns out to be a breast tumor. Advanced breast is very hard to treat, and it normally progresses so fast because of the location. Just from the chest, there's the lungs behind it, then there's a liver. So self-breast care is very, very important. Whenever you know something different, seek care. Just that, because our main focus is the prevention and early diagnosis. So wherever maybe you have a family history of breast cancer, make it routine, going for various visits. Because the prevention and early detection, the most important part in cancer management, not the advanced tumor. You understand? So for those with maybe maybe they have something abnormal already in their breast, we advise them they should look for us. Just visit any facility.
And how can they get you?
So for me, I'm actually in Nairobi Women's Hospital. Our location is in town here, the CBD. You can easily come find me there. We have many surgeons, so we have all diagnosis techniques, and we can really help you in good time. Yes.
Thank you so much, Dr. Abuto.
Welcome.
This was a very insightful interview, and I hope you guys have picked something about breast cancer, and you're going to work towards ensuring that you check yourself. Self-care is very important. So check yourself. If you have the opportunity, you can go and get screened. Umesikia, most of the times inakuanga free. Just go get screened and take care of yourself. Don't be ignorant, okay? We're going to take a break and we're going to come back right here, so don't go too far.